Hi, my name is Michael Tran, and welcome to Floss. I'm excited. I'm going to give you guys an inside look on how we do that dental implant process. So what we believe here is no more dentures. And I'm going to show you guys how we take all our patients if we have no teeth, and we'll give you a brand new smile with dental implants. So the two main categories of implant patients are somebody who's headed to dentures. Maybe they have bad breath, flared out teeth, and maybe their other dental office told them that dentures were their only option. So they've avoided coming to the dentist, or maybe they're scared. For those patients, we'll take out all their teeth and give them a fresh new pair of teeth. Okay, and they'll have a brand new smile. And then the other set of denture or implant patients are patients that's wearing a removable denture now and it's flopping around, they can't really eat much. And for those patients, we can place some implants and fix their new set of teeth, or we can give them a snap-on and snap-out denture for their implants. So in our office, we would like to say no more dentures. We would like to make sure all the dentures are tight-fitting and they stay in your mouth, and no more flip-flopping around your mouth. In Texas, it's a big problem. You probably have hundreds of thousands of patients, maybe even over 1 million, that have dentures that are loose-fitting and they can't really eat, they can't really smile. For those patients, we can give as little as 4 implants. We'll give them a brand new set of teeth that don't come in and out. So we have options for patients that can no longer save their teeth or they're currently wearing dentures. The first option is we'll place 2 implants here usually, and they'll secure their denture so it's not falling out. You're going to get a lot better result than a denture that's ill-fitting, that you can't really eat much. And a better option, well, we don't really do that option that much anymore because it's better than a denture that stays in your mouth, but it's not as good as a full set of fixed teeth. So a better option would be, we'll give 4 to 6 implants, and you'll get a fresh set of teeth that stay in your mouth permanently. With dentures, the whole palate and the roof of your mouth is covered. So then when somebody gets a denture, they have to adapt because you're not tasting your food anymore. What we can offer is, with our implants, we'll place the implants and your teeth are fixed to your mouth, and we can cut off all of that palate. So when you're chewing, you can taste all of your food now. And that's what really patients with implants love. They can eat and taste all of their food. So I get the question all the time that patients state, I'm too old for implants, or I ask, how old do you have to be to get dental implants? Well, my father is in his 80s and he was really reluctant because he had a loose-fitting denture, and I placed some implants in there and he had a fixed set of teeth, and he always tells me, I wish I would have done that sooner. And our oldest patient is actually 93 years old, so I don't think you're ever too old for dental implants. If you can walk in our door, then you're healthy enough for dental implants. This 93-year-old comes in, I don't even know he's 93, he just walks in and says, I've been saving up for this my whole life, I don't want to die with this money, and he says, I want a brand new set of teeth. I look at his 3D x-ray, I said, okay, you've got enough bone, let's place these implants. We get him a fresh new set of teeth, and now he says he loves it, and he says, I wish I would have done that sooner. So when you're 93 years old, you're always having get-togethers, family members. He always told me that he would be embarrassed or would try to eat before the other family members would get there because he didn't want his denture to fall out. Now he says he can have a good time at parties, he can laugh, he can eat, he's just enjoying his life again. So I think the most rewarding thing in dentistry is to give somebody with no teeth and give them a new set of teeth that they can eat and smile with. Because in dentistry, we can just match this one tooth and maybe somebody's getting one veneer, and it's the hardest thing in dentistry to match, but that patient is like, and they're still not quite, they're still being picky about it, and we got to get maybe a few appointments so they can really appreciate it. But when we give somebody a fresh set of teeth, they're eating, they're smiling, they're enjoying life. And it's just the most rewarding thing that we can do in dentistry. So how the dental implant process typically works is, you go to an imaging center to get your 3D x-ray, and then you come to the dental office, and then you get your treatment plan, and then you've got to go to the surgeon to get your implants, and then you got to go back to the dental office to get your restoration of your new set of teeth. What we do differently is that we bring that all in-house, so you don't have to go to all these places. You'll come into our office, we'll take the 3D image in our office, we'll give you a treatment plan, I will place your implants, and we have our own in-house lab, and that allows you to get your teeth the very next day, or in some circumstances, we can get your teeth the same day. All right, so let me give you a tour of the office. So we have 8 operatories here. So when the patient comes in, we're gonna bring them in to get a 3D x-ray, and that's our unit here. So that's gonna give a whole view of their mouth, a lot of detail, so we can digitally plan the implants. And then right here, we have our digital intraoral scanner, so when we take an impression, it's like a video camera of your mouth. You're not gonna have that goo in your mouth like in the old days. And then once the assistant takes the digital x-ray here with the 3D machine, we're gonna go back into the operatory. We're going to sit the patient down, and that's when the assistant is going to take all the records, meaning we're going to take the photos, and we're going to talk to the patient, introduce the patient, and that's where I'm going to meet. After the records are taken, I'm going to come and meet the patient, and we're going to talk to them and see how not having teeth is affecting their life. So once that process is there, we're going to get a treatment plan, and you'll be able to see how you'll be able to chew and smile again with dental implants. We know patients don't like coming to the dentist. They tell me every day they hate the dentist. So I smile at them, but everybody tells us they love coming here. I work with my wife, and they tell us that we're the best husband and wife dentist combo they've ever seen, and they refer all their friends and family to come here. I've heard that when somebody's a dental phobic or they hate coming to the dentist, they always ask for my wife because everybody says she's amazing working with anybody with fear and coming to the dentist. And she's really gentle. She sees all of our kids as well. She's just really gentle with the patients, and anybody who's fearful of the dentist, I'll tell you, we had this one patient that said she never came to the dentist, but after she came here, she just is so comfortable now. She would have to get sedation every time, and she comes to our office now and she gets no sedation. She said it's just like waking up and going to any other appointment.
So I'm Dr. Castillo. Here I do a lot of the restorative dentistry, the cosmetic dentistry. What I always like to tell the patients is a little story about myself and what brought me here. Growing up, I had extremely crooked teeth. I mean, when I closed my mouth, you could see my teeth sticking out. I mean, I was even kicked out of some photos for having such a bad smile. I was in braces from the time I was 9 to the time I was 14. And after that, after taking my braces off, it became an everyday almost occurrence that people were telling me, wow, you have such a beautiful smile. You have such a beautiful smile. And it just stuck with me that I was very, very proud of my smile. And I always smiled. I don't think that I think that if I didn't get braces, I probably would have never had the confidence to pursue dentistry and make me the person that I am today. So that's what I do. That's my mission in life, is to change people's lives with their smile, because I know that a smile can change someone's life like it has mine. Here I see most of the children. I started off in pediatrics. That's really helped me hone my empathy, helped me understand my patients with dental fear, dental anxiety. Patients come to me as young as 2 years old. What I like to do is alleviate their dental anxiety so they don't grow up to become adults with dental anxiety. You know, it starts when they're young. Making them comfortable in my chair, getting to know the dentist, getting to know me. I do the cosmetic dentistry in the practice. I see a lot of soon-to-be brides. You know, maybe you've got a little chip on your tooth and you're not ready for, you know, full crowns, full veneers. I can do a little bit of bonding. That's just a little bit of white bonding to smooth out that chip or contour those your teeth to make you happier with your smile. I even do no preparation veneers. So no preparation veneers means I don't need to destroy your teeth to give you that perfect smile that you want.
For 30 years, I had a removable partial. And so brushing your teeth, you have to, you know, take it out of your mouth, brush your teeth, and then put it back in. And I just got tired of doing all that. I saw an ad for Dr. Tran. And so I called and made my appointment because I wanted my partial to be removed. And because that was a problem, brushing your teeth and having to take the partial out. And so he looked at that, he removed the partial and gave me implants. And so today I'm very comfortable. And now that I've had his work done, everything fits better. And my smile to me is just very pretty. And today I feel very comfortable with my smile because my teeth are whiter and youthful looking.
So this is Joe. He's our lab man. He's actually what makes our smile so beautiful. He's been a lab technician since 1993, and he does the painting of the teeth, the characterization. So your teeth, when you have dental implants and porcelain teeth, they look real and they don't look fake. So when our patients smile, they're happy with their smile, and they actually smile a lot more.
Hi, my name is Joe. I'm a ceramics. I work with Dr. Tran. I create smiles for him. I make a crown bridge, but from now we make a nice material. In back days we don't have such a machine in back days, but now we can make the teeth just exactly what the patients like. The way I make it real, that live, so the patients think is really real. What I do is sometimes we cut it back 1/3 incisor, and at the gum we stain and we put porcelain at the gum. So you make the implants look like live to the person, to the patient, come to the office. Right here, we make it right here at the office.
We see big transformations every day here. Take this patient. He's actually a deacon at a church, and he said 2 weeks before he met me, he was praying at the church hoping that somebody could fix his teeth, and he was in a lot of pain, and then he found us. And then this is how he was before. And he was just in a lot of pain, and he thought his only option was a denture. When he came in, we said, you don't have to have dentures. We can give you implants and you can have a fresh set of teeth that you can smile with, and you don't have to be embarrassed when you go to church anymore. So for him, this is what we did. We did all of the planning like we usually do. We took our 3D x-ray, and we took our photos, and we designed his surgery on the computer. What does that mean for him? So when he came in, we took out his teeth and we had a surgical guide that's matched up to his jaw. That allows us to do a surgery very, very quickly. We did his surgery in an hour. So he was in and out, and he had a brand new smile that same day. He had some temporaries, so he had to be easy with it and not chew on hard things, but he left with a brand new smile. And that day, he sent me a selfie actually, and he says he was just so enjoyed that he couldn't believe he was smiling again. And this is his after. Look at these when you put them side by side. He definitely looks younger, more handsome, and he even told me here, he's smiling a little crooked and funny. He even told me, he says, man, Dr. Tran, I've never smiled before. I'm gonna have to get used to smiling because I was always hiding my smile when I smiled. And he told me, he says, you know the thing about having bad teeth is, people never talk to you in front of your face. And he said people would talk to him behind his back and he would hear about it. But now he's just smiling and grinning everywhere he goes.
My teeth were so bad that I was actually called a meth head in my church people group, which I had never done that. It came to the point I had to get something done. I was miserable with what I had. I was headed for dentures, and I did not want a denture. I prayed in our Bible study group for a dentist to come into my life. I knew Dr. Tran when he was 10 years old. He was friends with my son. He then reached out to me when I was needing my worst time in my life, when I needed new teeth, and helped me get the implants that I was looking for. I met with Dr. Tran, and he said dentures were not an option. I couldn't eat anything before. Chips, steaks, apples. I didn't even smile. I tried to hide my smile from everybody, and I have a business and a very social person. It killed my joy. Now I can eat anything. Steaks, apples, chips, just a life-changing thing for me. I love smiling to share my joy with others, and now I don't have any problem doing it wherever I go.
I really believe the smile is very important, but don't just ask me. There's been a lot of surveys, for example, Men's Health, or different magazines and surveys. The smile is always the top 3 when somebody remembers somebody for. So the smile is definitely very important, and we can see it in this man's transformation, that he's just smiling and he looks younger, more intelligent, and just happier. People with bad teeth are judged. For example, in Hollywood, if you want to make somebody poor or evil, you're going to give them bad teeth. But the star of the movie is always going to have nice, beautiful smile, white teeth. But here at our office, we don't judge anybody. We just want everybody to come in and be proud of their smile and have a nice, beautiful smile and enjoy their life again. So most of our patients are very anxious and scared to come to the dentist. What we offer here is sedation. So even the night before, we're going to give a pill so everybody can sleep at night. Because before, when we didn't give a pill the night before, patients would stay up the night before, but we want to make sure the whole process is comfortable. So we'll give a pill the night before, everybody says they sleep like a baby, and they also say that was the best sleep they ever had. So when they come into our office, they're well rested, and then we offer IV sedation. So we'll do it real comfortably. We'll give some IV sedation. It's going to be totally safe. We'll have monitoring here. We have a pulse oximeter. We'll monitor the oxygen the whole time, the respiratory rate. It's very, very safe. So after the procedure, most of our patients say they didn't remember anything. It's very, very common that you'll have some amnesia, and you might remember when you're first getting sedated and they say they're laughing, and then that's all they remember. So here's another patient. He had upper and lower dentures that he actually didn't wear at all. He said he couldn't eat with them, so he was actually smashing his food with his upper and lower gums, the roof of his mouth and his tongue. And when you look at this photo, this is actually how he was walking around town. And so you can see he was a lot unhealthier in this photo. And he told me once he got his fixed teeth, he stopped smoking, He lost weight, he started taking care of himself, and you can just see it in this photo how much weight he's lost. He looks younger, healthier, definitely more handsome. And he just tells me all the time, Dr. Tran, I thank you for giving me this new set of teeth. It's funny with him because he came in with his wife, and his wife actually sent me a text message with his photo, and they posted his photos on Facebook for us. And she said that I've never seen him smile so big and so much after he got his teeth. So this patient said he loved to eat steak, and that was the first thing he says, Dr. Tran, am I gonna be able to eat steak at this restaurant? And he gave us his favorite restaurant. So after we delivered his new set of teeth, we sent him a gift certificate to his favorite steak restaurant. And he said it was the best steak that he ever had, that he could actually chew and eat his steak again. Patients like this, he was walking around without any denture and any teeth for 10 years. And he was just scared to come to the dentist. But we gave him his teeth. He felt like he gained his 10 years of his life back. If we could have just gotten him in earlier and told him there's a better way of life than just having dentures that don't fit or hurt or fall out of your mouth, he could have just enjoyed all these steaks and all these foods that he's enjoying now 10 years earlier.
For 10 years I went without teeth, and it was very difficult in public and to eat anything. My dentures never fit, and I tried to wear them. I'd wear them during photos and stuff, but I just to try to eat or anything like that, I just couldn't do it. I kept choking on them. My wife heard about Dr. Tran, and she drugged me in there pretty much because I was tired of doing it. I was tired of messing with it. But now I got it done. I'm glad I did. I got them all done. I had nothing for, I went years and years and years with bad teeth, and then now I got teeth, and so it's great. When I ate my first steak, it was totally different. I could taste it. It wasn't just like, squeeze it and swallow it, So it was good. I like them. I can eat apples, salads, steak, corn on the cob, especially. Love corn on the cob. Barbecues, ribs, chicken. It's a big difference. It's a total difference. It's one of those things I wish I'd have done years ago, but I didn't think it was possible. I can eat peanuts now. I love peanuts. All I could eat before was peanut butter. Now, like when I go hunting or stuff like that, around a campfire, peanuts, beer. Absolutely.
Patients like it that we're able to do this process so quickly. What kind of keeps them at home and not doing this process because they heard that it takes a year, or they're told that they can only have dentures. And for me, it used to take me about 9 to 12 months when I would use an outside lab and I would have to send things to the lab. But what we have now is an in-house laboratory. We have all digital equipment. So we're gonna plan the surgery. It's a lot faster, so we can get your teeth actually the day after tomorrow if you come in. But the first thing is you have to come in, we'll give you an exam, we'll bring you in, and we can get your teeth so much faster now. You'll have a temporary set of teeth, and as soon as the day after tomorrow, and even some instances tonight, you can walk out with a fresh new set of teeth and be smiling.
I was headed to dentures, and I just didn't think that was a possibility for me. I saw Dr. Tran for the first time and really discovered that there was hope. And here I am. This is brand new. Last night, for the first time, I saw my smile restored, and that is a hell of a feeling. I haven't eaten anything since my appointment last night here at Dr. Tran's, but I intend to do that today. So I think I'll go buy some apples and other things. It's been a hell of a journey, and the thought of being able to chew to liquid for digestive purposes, and it's just everything that's involved in this. It's not just aesthetic. I can't wait to be in front of clients with that confidence once again, and Dr. Tran really helped me. We worked together to get me to the most comfortable place ever. Experienced some anxiety with the injections, but that's typical. I mean, take my blood and I have that anxiety. Wonderful experience.
I hear this a lot. Patients are told by another dentist, and we actually get a lot of referrals from other dentists here. They're told we don't have enough bone. So what we can do here is we can grow the bone wider, and we can also grow the bone taller. So it doesn't, any patient basically that comes into our office, there's a solution to get dental implants. I know a lot of patients, they come in and their other dentist told them you don't have enough bone, and that's when these other dentists are referring to us now to grow their bone to get the dental implants. So here's another patient that came in. He hadn't been to the dentist in 40 years. Terrified of the dentist, just terrified. So of course we offered him sedation. And the funny thing is he and his wife were talking and saying that, well, we were thinking about buying a pool, but he thought that maybe he wanted to be able to eat again. And I told him, you're making a great decision by coming in here, because I guarantee you, you're gonna use your new set of teeth way more than you use your pool. So we brought him in, we took out his teeth, gave him a temporary set of teeth. He was able to eat during the whole time with that. And then now he's smiling real big, he's healthy. He says, you're right, Dr. Tran. I use these teeth every single day. I use it way more than I would have used a pool. So these teeth don't come out at all. It's just like regular teeth. You have to take care of them also. Your implants you have to take care of also. So he comes in every 6 months. We'll clean around the implants, give him a cleaning so his implants, and he's very healthy. And we'll keep the implants clean so they can last the rest of his life. So when we give patients a new set of teeth, they're smiling, they're laughing more. So before, sometimes patients say that they're always friendly, but they're embarrassed of their smile, so they're not smiling. So when they go to a party, sometimes people think they're not friendly. But now, when we give them their new set of teeth, they're coming to parties, they're going to family reunions, they're smiling, and people say, what's going on with Mr. Jones, for example? And the wife will say, oh, he just got his teeth now, so he's just happy with life, he's smiling all the time. So you do get judged when you don't have teeth, and somebody can be the most friendly person, but if they're not smiling, people will judge them.
I've been wearing dentures for 30 years and it was awful. I've had several pair because I would go to different dentists trying to make them fit perfectly, and that didn't happen. I found Dr. Tran and he did my dental implants and I couldn't be happier. They really are life-changing. They don't come out when you're trying to eat, and I can eat steak, corn on the cob, everything, and it's just life-changing. I love them. Before, I couldn't eat corn on the cob, I couldn't eat apples, I couldn't eat steak. I basically ate sausage, canned Spam, and soft meats like that because of my dentures. And now I can eat anything I want, whenever I want. I smile more, and I do get a lot of compliments. My niece noticed the other day, she's like, I thought you were going to get different teeth. And I said, I got these dental implants. She's like, really? They look amazing. So that made me very happy. I did get sedated. I really didn't even remember leaving here the first day. And I woke up at home and I told my husband, I'm like, wow, that's the first time I've ever left a dentist office that I didn't remember, and I wasn't in a lot of pain. I thought it was going to be very painful, so I stocked up on ibuprofen and aspirin and all that, and I really didn't even need to take them. He was just so gentle. And that's the truth. I didn't even need to take anything after my dental implants were implanted.
A lot of patients have questions about financing and insurance, but Medicare, Medicaid, they don't pay for dental implants. And even if you have the best dental insurance, they're not gonna pay for all of the dental implant procedure. What we're gonna do is we have two team members up in the front that all they do is help you fill out the paperwork so we can get every penny out of the dental insurance company. And then we do offer patient financing every single day. So at every appointment, we're doing that every single day for our patients. We just make it very affordable so you can get dental implants.
I wish I would have done it years before, but dental work is expensive and I had no insurance. I had to pray and reach out to good-hearted people like Dr. Tran came to me, concerned about my health more than anything. He got me healthy and cosmetically doing well. I was worried about all the pain that would go with the implants, which I had 9 of them. I didn't have any extra pain, was not subscribed to any pain meds, only went with some Advil. Dr. Tran goes to classes all over the world. He is highly skilled. Everybody wants to be Michael Jordan, but not everybody can be. He is very skilled at what he does.
I loved him from the very day we met. I looked a little bit skeptical, probably. He doesn't look old enough to be an experienced dentist. But in fact, wow.
Dr. Tran made me very happy with my implants and a prettier smile.
It was definitely worth spending the money on. I wished I'd have done it 30 years earlier because it's just definitely changed my life. I feel more confident and I love my smile. And I'm not scared my dentures are gonna fall out.
My personal life has changed so much. I deal with many people having my own business, and it was horrible not being able to smile, especially at the pretty ladies. So I would say that my business has increased from 10 times the amount, from maybe 2,000 a week up to 20,000 a week volume now, and I can do that with a big smile on my face.
Once people see it, they're not gonna believe it. Yeah.
So in our office, we would like to say, no more dentures. So we have this sign on the wall. This is really our philosophy here. A smile is the prettiest thing you can wear. And we've just transformed so many patients' lives now that they come in with very little confidence, and then once we give them their implants and then they don't have dentures anymore, they can just smile. They say they're meeting their husband or wife and they're getting better jobs and promotions.
If a grumpy old man acts like he don't really, care about teeth anymore, he give up. Don't give up. Life is full. Try to fill it. And a lot of good food out there. And try eating a hamburger or something without teeth. It really does look funny.
Dr. Tran and his whole staff are amazing. They made me feel so comfortable. Like I said, I've been to many dentists and I would go one time, I wouldn't go back because I did not feel comfortable. I love coming here. I literally love coming here because I know they're gonna solve my problem, and they did solve my problem. They're just amazing.
We do it all here under one roof. Not only does Dr. Tran place implants here, but he actually teaches as well other doctors how to place implants. If you don't like your smile or you have a loose-fitting denture, give us a call. Find out your options. We'd be more than happy to talk to you.
Getting started. We'd like to bring you in. You can either make an appointment online or you can call our office. We can bring you in, so if you're in the two categories of teeth, either one, you're headed to dentures, or two, you have ill-fitting dentures that just don't fit, come in. We'd like to give you your options. We'll give you a free consultation, we'll give you a free 3D x-ray, and we'll give you a treatment plan so you can get your brand new smile.